Every 3 minutes, a person in the U.S. is diagnosed with blood cancer. Patients who are recently diagnosed, they often, of course, face emotional, physical, and in many cases, financial challenges. And as we recognize Blood Cancer Awareness Month, the Leukemia and Lymphoma Society wants to remind anyone affected by blood cancer that they are not alone. And with that, we welcome Dr. Nichols and Melissa O'Neill-Walczak joining us live with some critical resources. Thank you for being here with us.
Thank you for having us.
Thank you. Dr. Nichols, can you walk us through some of the unique challenges that blood cancer patients face?
Well, I think the biggest challenge is a challenge of information overload. When patients get diagnosed or start a new treatment, or even during survivorship, it's a whole new language and a whole new set of information and new tools that patients need. And of course, your healthcare team is number one in terms of getting that information. But there's such a new language and so much to learn. Many people don't even know that their diagnosis is a blood cancer because it isn't just leukemia. It's leukemia, lymphoma, multiple myeloma, Hodgkin's disease, myelodysplastic syndrome. So many different diagnoses fall under blood cancers. Patients need good quality information, and there's lots of information out there, but you want it to be information that will be consonant with that of your healthcare team, and LLS has that information available for patients, families, and caregivers.
That's good to hear. And Melissa, as a blood cancer survivor and an advocate, how can we best support our loved ones who are on this journey?
Well, as a patient, I was being presented with a lot of information, very quick, and trying to communicate to my family and friends and you know, understand it myself, let alone explain it. So started to reach out to other resources such as Leukemia Lymphoma Society, was able to provide them with a website that they could look for caregiver tools or resources or questions they could ask me or information that I could share with them. Even just when, you know, Dr. Nichols refers to the terminology, leukemia was a new term for me, let alone all of the other treatments and just plans that I needed to move forward with. So being able to really educate yourself, looking to a resource that's reliable, such as Leukemia Lymphoma Society, being able to connect with a community that has either gone through it or is going through it with you, and being able to share that information was just priority for me.
And as we mentioned off the top, there's also financial constraints to think about here for many people. So Dr. Nichols, tell us about the Leukemia and Lymphoma Society's free support services and how patients can access those.
Well, thank you. Yes, I think the most important thing is all the cures that are and all the great new treatments that are coming out, thanks to, in part, to the research that we do and support, don't mean anything if patients can't afford them or can't access them. And so we want to tell people it is not, you know, there's no shame in saying I need some help. And LLS, all of our resources are free. You can contact us about whatever is troubling you anywhere in your treatment process. And we will find both internal and external, local and national types of help, whatever you or your family may need. It's so important to get the information, to be able to take the treatment the way it's prescribed, and to not have your family destroyed by a cancer diagnosis. We want to help.
Dr. Nichols and Melissa with the Leukemia and Lymphoma Society, we so appreciate chatting with you today. Thank you.
Thank you so much.
Thank you.
All right.